As you know, COVID-19 virus is ravaging our communities, and in rural areas, while our numbers are smaller, so is our population density, but even a few deaths in our communities are devastating. We have nothing but praise for all of our healthcare workers who are putting their lives at risk to help us. We are calling upon the Attorney General's office and the State Department of Health to immediately investigate the Villages of Orleans nursing home. The Orleans County Legislature made the decision today to request a formal investigation. The facility has suffered over a dozen deaths and continues to be the focal point of COVID-19 in Orleans County. And the safety of our residents is the utmost importance. So the decision was made to send a formal letter to the governor, to Letitia James, the State Attorney General, and to Honorable Howard Zucker, MD, Commissioner of the New York State Department of Health. And that will go out today. And of course, as I said, we have nothing but praise for the healthcare workers in the facility, but it is our hot point in Orleans County. And based on the many requests we've had from the residents of Orleans County, the legislature is now being proactive and taking the concerns of the public to our state officials. Thank you.
Thank you, Chairman Johnson. And good afternoon, everybody. My name is Paul Pettit. I'm the Public Health Director for Genesee Orleans County. And it's a Friday afternoon, and we are back here again to do our in-person daily Zoom press briefing on our Friday afternoon. So as Chairman Johnson just said, we definitely want to thank our healthcare workers, our first responders, personally, a little bit biased here, but my public health workers that work within our two county health departments. All of these folks are at the front lines. They go to work every day. They're working long shifts. They're putting, their lives in harm's way when it comes to COVID-19 and dealing with those that are, infectious and have the disease. And, I think it's incumbent upon all of us to continually to think of them and to have them in our minds and our thoughts and our prayers as, we continue to move through this COVID-19 crisis in our communities. Again, they deserve our thanks and gratitude. So it's very important that we continue to do that on a continual basis. So with that being said, I'm going to do what we typically do on Friday afternoons. I'm going to run through some data, situational update, go through some various high points that occurred throughout the week that we wanted to share and make sure that we're verbalizing so that folks have a good understanding what's going on here locally. Again, what we've been trying to do over the last 2 months almost now is to provide factual information that is local. Again, we can find national data, we can find state data, but it's not always easy to find out what's going on the ground locally. And our goal here is to be transparent and to share information to the best of our abilities and what in line with what we can share, so that our public is informed and educated and can hopefully make the best decisions they can to protect themselves and the ones that they love. So with that being said, I'm going to run through our numbers here. So as of 2 p.m. today in Genesee County, we have one new positive case for COVID-19 for a total of 150 cases in Genesee County. So again, one new positive case. The resident resides in Batavia. They are in their 70s, and the new positive individual was not on quarantine prior to becoming symptomatic. 3 of the previous cases that have been recovered and have 3 of the previous positive cases have now recovered and have been released from mandatory isolation, and 4 of the active positive cases are hospitalized. So again, that is 4 of the total active cases are hospitalized. Jumping over to Orleans County, we received 1 new positive case of COVID-19 for a total of 96 positive cases. So again, 96 cases now in Orleans County. The positive case resides at the end of the right, resides in Albion. and the individual is in their 30s. This individual had been on mandatory quarantine prior to becoming symptomatic, and 5 of the total active cases in Orleans County are currently hospitalized. I'm also reporting this afternoon that Orleans County has lost 2 more residents to COVID-19. They were both residents at the villages of Orleans and rehab facility. Both were over the age of 65. And again, as we've been saying over and over again, our deepest condolences to the family, to the friends of those that we're losing. And, it's a difficult time for all those involved and difficult time for our community as we deal with these losses. So again, our condolences to the family and friends during this time. It's something that we need to continue to keep in mind. These are our family, our friends, our neighbors. These are parents, grandparents, brothers, sisters, and anytime someone is lost, again, there's a grieving period and just an opportunity to reflect and just think back on the positive impact that those folks had in people's lives. And so again, we take all of these losses seriously. And, again, as Chairman Johnson mentioned, the county legislature is formally looking for an investigation into activities down there. Again, these losses are something that hits us all close to home. So again, our condolences. Cumulative data. So again, we were reporting on this and what I want to do before I actually go through this, I'm going to have a screen share here. It's going to jump over to our mapping system. And one of the things that we are changing today, we discovered this week, we're looking at our data, we were wondering why our isolated cases were not coming down to the level where they should be. Because again, we're tracking and visiting all these locations on a daily basis. And, we're running in the 70s and the 50s in Orleans County. And that's not accurate, reflective of really what was going on as far as in the community. So what we, discovered was that we, had kept all of the regulated facility positives under the isolation. So when we have a positive case, they go under isolation, and these folks were never getting cleared. Since we don't follow them, we're not in charge of their isolation or their quarantine since they're in a regulated facility. We had no way of knowing when they came off and potentially became recovered. So again, we're adjusting the data to show that. So as you look on the map, you'll be able to see that now there's the cumulative data that's there, but if you go to the active data, you'll be able to see now that graph has been adjusted, and now it takes into account only the active cases in the community. We've removed all the cases from the regulated facilities from that tab. When we report positives, negatives, and then deaths, and those are all going to continue to hit on the total for the county. But when you go to active cases, that's only going to hit on, again, community cases to give a better idea of what's going on. So as you look at that, I'm just going to run through the numbers again for each county. So Genesee has 150 confirmed positive cases, 880 negative cases. We have 14 individuals under isolation. Again, that's a drastic decrease from what we've been reporting. Again, taking into accommodation of removing the facilities that are regulated. We have 52 under mandatory quarantine, 3 deaths, and 81 under recovery. Orleans County, 96 positive cases, 566 negatives, 16 under mandatory isolation, 40 under mandatory quarantine, 0 under precautionary, 13 deaths, and 31 now recovered. So again, there's a couple other charts there. They're always included in our daily updates and briefings. I'm not going to run through all that data, but it breaks it down by age and also by non-county public regulated facilities. So again, we continue to modify and change our charts as we go along. We realize that not all of these things are perfect in how we want them. So as we move forward, we're continually looking for ways to tweak and modify them again, hopefully providing folks, again, a good snapshot of what's going on a daily basis in our community, so that, again, we can track COVID-19 and see how it's impacting everyone in Genesee and Orleans County. So as a reminder here, the health departments do not have oversight in any of the regulated facilities that are overseen by the state of New York. And, it includes potentially nursing homes, correctional facilities, the federal detention center, any of the VA, and those other types of facilities. So, we do have very limited ability to have impact in those facilities. We do have good communication. Whenever we've had positives in the facilities that are listed there, we do have good dialogue, we have good working relationships. We are providing assistance and we're providing guidance. But again, we are limited in the scope of our ability to go in and do things. That does fall to the regulatory authority, which again, in nursing homes is the state of New York. And obviously in the Federal Detention Center and in the VA, that falls to the federal government. So again, specific questions around what's going on in those facilities in detail. We don't necessarily always know ourselves because again, we're not involved in that, but also we do not have the ability to go in and do those things. So those questions need to go directly to the regulatory authority over those facilities, or they need to go to the facility themselves and seek answers in that fashion. So a few other things moving forward. So we're going to, with the map, continue to include all confirmed cases, tests administered, total negative results, ages, deaths, and the cumulative for both counties and facilities. So hopefully, as we move forward, that'll be again a little bit easier for folks to recognize. In addition, obviously, the state of New York does have the state attorney general procedure now for investigation of nursing home and other regulated facilities. And there is a number that's available, 1-833-249-8499. And there's also a website that folks can go to if they would like to, have any concerns and reach out to the state for assistance and guidance. So that is something new that the state has been doing for about a week now in response to, many facilities across the state that have been struggling and dealing with high number of COVID cases. So again, that is available. Some other general updates on things, swabbing and antibody testing. Again, not where we want it to be, but we are seeing signs that there is more access within the region, I'll say. Again, Orleans County specifically, there's not additional community type testing locations. Genesee County, obviously there's Tent City at UMMC, and we have heard that one of the urgent cares down there is now offering swabbing and antibody testing. There is access regionally in Erie County, Niagara County, Monroe, that is available for essential workers, and that they can make appointments and potentially go get swabbed. There's also random, so to speak, at the moment, antibody testing being done by the state as they continue to try to build a profile of potential antibodies across the state. So they're out there, they're doing these mini clinics at various locations around the state at various times. They're random. You don't get notified when they're happening. They're just literally showing up and taking a sample of folks that may be at the grocery store or maybe whatever facility they're at and testing those antibodies. We are very hopeful that that will become more available locally for us. We do know the governor announced that pharmacies are going to be coming online as a place where folks can get swabbed. Again, very little guidance on this. There's not a blueprint that has been laid out that we're aware of yet of how and when that's going to be launched. But we do have many pharmacies in our communities in both counties, so we're very hopeful that that will provide increased access for folks to go get swabbed and ultimately find out, potentially if they have COVID-19. So again, that's evolving. We do have there is a link that's on that folks can click on again if you're looking at our daily briefings, or if you go to the State Department of Health website. There is a way that folks can find additional access locations for swabbing and antibody testing. All right, so one of the big things we want to talk about today, and we've been putting it out in our press briefing throughout the week, is prepping for reopening. We've obviously spent 6 to 8 weeks now talking about numbers and talking about things being shut down and guidance on how to social distance and try to flatten the curve. And as we all are very aware, New York State is on pause till May 15th. And there's a lot of discussion and a lot of thoughts right now about what's going to happen when May 15th comes. And we are very hopeful that we will be in a position, especially locally, that we will be able to hopefully move forward and begin to peel back some of these restrictions that have been put in place. I do want to be very transparent and clear with our communities that, again, we don't have flexibility locally to do anything outside of what the governor has essentially put into his executive orders at the state level. He's made it very clear in those that localities do not go beyond or do things outside of what he has put as far as the regulations and restrictions that have put upon our businesses and our localities. But it is going to be driven by data. There is a process that they're still honing out. Again, we don't have all the details. He did provide a 12-point plan that regions need to be prepared for. He's also made it very clear that this is going to be a regional approach. And for Genesee and Orleans County, we are part of the Finger Lakes region, which includes Monroe County and all the Finger Lakes counties around the east side of Monroe and south. So we're essentially tethered to that region at the moment as far as it goes for unpausing New York and in our region. So again, we've been working closely with the other healthcare agencies, with the municipalities. There's a lot of calls going on, trying to figure out exactly what the plan is moving forward and how we're going to be ready to reopen. Because again, today's May 1st. We're 2 weeks out now from that time period. So the biggest thing we want to do is make sure we're ready. And that's one thing I just want to spend a few minutes talking about here is, getting ready for that. I mean, we've been waiting for a long time. I know we've discussed this week after week that, there's definitely a high percentage of us, myself included, where we want to get back to some semblance of getting back out and starting to enjoy our venues and getting back out in our communities to do different things and participate in different activities. And in order for us to do that, we're going to need to develop plans. We're going to need to be prepared. So when we get the green light, again, optimistically speaking, it's coming soon, that we're prepared and ready to go. So we are going to be, we're working with our businesses. We have phone calls set up. There's guidance that we're putting together, again, to try to get our businesses ready so that they can develop plans around social distancing, how they're going to accommodate reducing capacity within their facilities, how they're going to accommodate potentially asking and or requiring patrons to wear masks, again, to minimize exposure to one another when they're in these facilities. We've seen it in places that are open now, potentially markings on the floors, keeping people apart, one-way aisles, plexiglass at the checkouts. I mean, there's all kinds of different interim control measures that are out there that are going to be recommendations that facilities need to start thinking about in order to successfully open and be ready to go. So what we're doing is we're really trying to encourage folks to be thinking ahead, to be planning. One of the requirements that's in the governor's 12-point checklist is businesses and facilities that engage, that are open to the public, they have to have a plan. No guidance yet on how that plan is going to be reviewed, if it's going to be reviewed, if it has to be approved. Again, we don't know any of the details on that, but we do know you have to have a plan. So we're encouraging everybody to begin doing that now so that we are ready to roll and we can get moving when the time is right. Also, just for everyone in general, beyond the businesses, again, we're continuing to encourage folks to practice these social distancing measures. I've been out in the community at different stores and around, and again, people are doing a great job. No one wants to wear masks. No one wants to have to do these things, but again, this is the environment we're currently in, and the transmission rates, as we've been reporting day after day for you folks, is very low in the community. And I personally do believe a lot of that is due to the fact that, again, folks are being compliant. They're doing their best to not go out if they don't have to. When they do, they're social distancing, they're wearing their masks, and it is keeping the spread down. The numbers are not climbing. And what we want to be careful of is when things start to open back up, what we don't want to see is spikes and increases, because it's been made very clear to us from the governor's office that if regions start to see increasing cases, once they start to relax and pull back some of these restrictions, it's going to put us back on pause again. And it's going to go on 2-week cycles. 2 weeks of new businesses being open, 2 weeks of monitoring, 2 weeks of enhanced more businesses being open, 2 weeks of monitoring. And if we hit points, these different metrics around hospitalizations, around increasing numbers, these different metric points based on the data, it's going to potentially put us back on pause and or reverse us back to its pace. So again, there's not a lot of clear guidance that's clear yet on how all this is going to work, but we do know it's going to be a while, and we need to work collaboratively. We need to continue to push together as a region, as a community, as a county, and make sure that we're being compliant as we can so that we can all move forward and get things, again, back to some semblance of normal. So, again, I think, wearing these masks and these interim control measures are going to be with us for a while to come, and it's going to be incumbent upon all of us to do our best to adhere to those regulations and restrictions to keep the numbers low, so that, again, we're in a position where we can keep moving forward. And again, remember, the mask is about protecting others, especially these cloth masks, these barriers. They're not really protecting you, they're protecting others, and there is data coming out that's showing in percentages around when folks wear masks, how it does protect each other, again, from spray, from spit, and we know that COVID-19 primary transmission is through droplets, through talking within 6 feet of each other. All right, so again, we're going to continue to put out information on that, and there's more to come, but I am cautiously optimistic as we move forward now into May that we're going to make that first cut, that first round, and hopefully be able to unpause some things on May 15th. So again, stay tuned for more information on that. Again, I've been talking about it every week, but I'd be remiss if I didn't, again, bring up the mental health issues and impact that COVID-19 is potentially having in our communities. We do have outlets. We have places for folks to go. If you are struggling with anxiety, if you're struggling with other mental health issues during this time. Again, you're not abnormal. You're not strange if you're feeling isolated and lonely and discouraged. And there is help. There is outlets and places and people to talk to. We want to make sure that all of our residents have that opportunity and are taking advantages of the services that are available. So again, our mental health departments are available. There's other mental health agencies in our communities that are available to provide help. And again, we have a 24/7 crisis hotline that is available for folks, and make sure you take advantage of that if you need it. In addition, another thing that's been more readily brought up and some concerns out there is around domestic violence. Again, with people being shut in and not out and about, it is a concern we've been hearing some more about. And there is help for all New Yorkers and those folks locally that may be experiencing domestic violence or have concerns about a loved one. And there is a number they can text to get help, and it's 844-997-2121. And there's also an online site that they can go to, www.opdv.ny.gov. So again, if anybody's struggling with those issues, we strongly encourage you to reach out for help. All right, a few other things, and then we'll flip it over to questions from the media. The governor did announce today, as he indicated he would, that he was going to make a decision based for schools for the rest of the year. And I think somewhat from the health side of things, talking with my counterparts across the state, it was not a surprise that he has made a determination that all schools will remain closed through the end of the year. Again, as most folks are aware, this is a very difficult population when it comes to controlling spread of disease. We see it every year with any type of illness, flu, and other type of issues that kind of run through the different school systems. And COVID-19 will be no different. So again, schools will remain closed through the end of the year. There's not any additional guidance on summer school yet. It sounds like he's going to be making that decision by the end of the month, in May. And then obviously we'll be assessing and monitoring throughout the summer, again, as we start to unpause things, how that's going to look for things moving into the fall. So again, that's quite a bit of ways away. And again, hopefully we can do a good job, keep the numbers low, and get things back and get kids in school coming back to the fall anyways. So again, we'd encourage you to keep in touch with your school district. I know they're doing a great job of communicating within their own districts, and they have their own means of communication. So again, stay in touch with those. There's a lot of different schools that are planning various levels of graduation ceremonies remotely and by kind of driving those type of things. So again, there's some work here to try to have some semblance of honoring and recognizing graduates specifically. But stay tuned to your own school, again, around food, around those type of things as we move forward through the end of the traditional school year. All right. Just again, a reminder out there that, if there are complaints against, regarding businesses, there is a State Department of Labor website phone number that folks can call. And then again, New York State on pause again through May 15th at the moment. There is a phone number and a website that folks can go to if there's concerns over businesses that may be open that shouldn't be. Again, over if there's large gatherings of folks that are out and about that should not be, there is ways to report those. And again, that goes up to the state. And then that gets pushed back down to typically local law enforcement to go and investigate and see what's going on. All right, so with that, I'm going to take some questions here. I'll turn it over to the media. So we're going to unmute media only. And I would ask that if you have questions, that again, you state your name and your newspaper or affiliation that you're with, and I'll do my best to answer the questions or get you the answers to those questions offline.
Mr. Pettit, Dan Fisher at WBTA. Is Mrs. Johnson available to answer a question about her remarks that preceded yours?
Unfortunately, she is not. She has left the room.
Well, maybe you can handle this one then, Paul.
I'll do my best.
All right. As I understand it, the legislature there in Orleans County is requesting an investigation of the villages of Orleans by the state health department. Assemblyman Steve Hawley told me earlier today that he's made 3 separate requests of the state health department to investigate conditions at the villages of Orleans, and that was prior to COVID-19. Why has it taken so long, in your opinion? And I understand that it's not under your jurisdiction, but why do you think this has taken so long? And is there any reason to believe that this will get the attention of the state health department now?
Well, I mean, unfortunately, I can't speak to why it's taken so long for the state to respond. And again, I don't think this is just the villages issue. There's many nursing homes across the state that are specifically dealing with COVID-19, and they have significant outbreaks occurring with a lot of positive cases and unfortunately a lot of deaths. And obviously, we're very unfortunate to have one of them in our own community that we're dealing with. I can't speak to, what's going on with the state, as I've been as clear as I can be. We don't even know when the state comes in what they're doing in the facility when they do come in. This is, we're not kept in that loop. I think it's very clear, though, that there is an issue down there. We've been reporting on that. Again, we've been in constant communication, my staff have, with their medical staff, with the medical director, with the nursing staff, and right from the beginning of the first cases. And we've been working through emergency management, and we've, again, been providing PPE as we've been able to get it right along. And, the villages is reacting as cases come along, and, we're giving them the best guidance that we can, but we really don't have any other ability to go in. It's outside of our scope, and that's why the action that's been taken today by the legislature is to formally go on record and to request that investigation. Steve Hawley, as you mentioned, Assemblyman Hawley, is continuing to make requests to have things looked at within the facility. But as far as if and when and how that occurs, again, the State Department of Health is going to have to answer for that and or the facility, which is why, again, we're encouraging folks to do their best to continue to talk directly to them and talk to the state. And I understand, I get the calls every day that they're not saying anything. The state is not saying anything. But again, it's really outside of our control. We're doing our best to provide guidance and, again, get them any of the PPE and any other materials that they need to safely take care of the residents and protect the staff at the facility.
Paul, it's Tom Rivers with the Orleans Hub.
Yep.
With the investigation request, I don't know if that's just an open-ended, will you do an investigation, or if it's specific about staffing, isolating patients, PPE, or, I just don't know if there's any specifics in that request.
I can't speak to the specifics of the request, Tom. I have not seen, directly what the legislature has submitted as part of that formal request. So I can't speak definitively to that. And then again, as far as being open-ended, these requests go in, but there's not a reply back, as far as I know, to any of the senders that are sending that in. As far as what the state's actions are, what the state does, like I said, if, when, and where, and how they come in and do what they do.
Okay.
The press briefing is continuing, and of course, we will continue to monitor what is being said there. I can't.
Paul, can you hear me?
Oh, yep, I can hear you, Howard.
Hi. So, Paul, only question I have today is when you look at, people are going to look at the trends, especially, what you show with the new way you're showing active cases. The curve is, definitely flattened the way it looks to me. And, I think there may be people out there who say, looking at the current trends, they'd be tempted to say, hey, we've got this, we've got it beat. Let's just get things back to normal.
Yeah, so I mean, I think that you know, our tendency would be to say that, right? You know, look, let's see what's going on. The numbers are flatter, the active cases are down, and as I mentioned earlier, I really want people to remember that the reason they are this way, we're very confident, is because we've been social distancing. We've been flattening the curve. I mean, we've done a great job. I've been trying to say every week, thanking the residents of Genesee and Orleans County for their diligence and, you know, their tireless efforts to do their best to adhere to the guidelines. And it has worked. You know, but as we move forward, I think what's important for folks to remember is what I hope to articulate it a little bit is our ability to keep those numbers low, to keep our new cases low, keep hospitalizations low, is really going to be able to, is going to drive our ability to open things up and get us back and going. If all of a sudden, you know, on May 15th, everybody's back out, everybody takes their masks off, starts going to the stores, starts going back to life as normal pre-COVID-19, there's a high likelihood that we're going to see increase in cases, and you see those spikes start to drive again. We're going to see more hospitalizations because, again, seniors, those underlying health conditions, those that are immune compromised, are going to start to, again, become positive and exposed now, and we're going to stress the healthcare systems and go backwards. And the governor's been very clear. Again, his order on this is what trumps every local order. And if he, again, data-driven, very clear that it's going to be driven by the data, that if we start to see increases, we start to see spikes, it's going to put us on pause. And the last thing I think any of us want, myself included, is for us to have to pause, potentially regress and go backwards and you know, have to start some of these things over again. I think we all want to be successful. We all want to try to move forward and, again, do our part. So, you know, again, I would encourage folks, you know, to take the data, you know, I mean, it is data, it's factual data. We're doing our best to provide that in a real-time and effective way. And be glad, you know, I think hopeful that what we've been seeing will allow us to move forward. We're just going to have to continue to practice these social distancing guidelines and these different strategies for a while to come to make sure we keep those numbers moving.
Thank you, Paul.
Yep. Other questions?
Tom Tharp from WBTA News. With the restrictions coming down from Albany about if there are spikes once we start going back out into public and opening businesses once again, do you think the concentration should be on keeping case numbers down or protecting vulnerable populations?
So it's a good question, and if you look at the governor's guidelines, it's really going to be more predicated on hospitalizations. They're really focusing in, again, that's going to hit more of our at-risk and target populations that we want to protect from COVID-19. So if you look again at that 12-point plan, it really hits in on hospitalization numbers, making sure that our healthcare system has a percentage of beds that are available to accommodate for COVID-19 patients. So those indicators are going to be the ones that really drive that. Not as much new cases, but again, you can make a correlation that as new cases go up, presumably you're going to increase hospitalizations because, again, we can't control, so to speak, who's getting infected fully. So again, there's going to be some level of, you know, monitoring both of those. We're going to continue to monitor the numbers as we go along, but it's really going to be focused in on the hospitalizations, at least from what we're being told now.
Thank you.
Yep. Other questions? Okay, well, I'll wrap it up then. So again, I'd like to thank everybody for their time this afternoon. And again, hopefully this information that we've been putting out every day throughout the week is helpful and provides some additional guidance and again, shows that local impact of COVID-19 in our communities. Just as a reminder, we do not update the map over the weekend, but we will be providing just brief numbers over the weekend and a number of cases. So again, we'll push those out at 4 o'clock every day-ish, anyways, on the weekend. And, you know, from there, again, I want to encourage folks to continue to do their best to social distance. We do remain on pause till May 15th. Let's prepare, let's be ready. And again, let's be optimistic that when May 16th comes, we'll have many more of our businesses open and opportunity to get back to some sense of normalcy in our communities. And let's do it safely. Let's do it strategically. Let's do it in a way that we, again, are protecting others by wearing our masks and doing what we can to do our civic duty to protect others in our community. So with that, I'm going to sign off, and I hope everybody has a good weekend. Thank you.